Nancy. Today we are going to discuss something important that many of you would be wondering, how this healthcare system works in Canada, whether it will be expensive or whether it is really free, how it will be for kids and how it will be for adults, and what about the kids vaccination schedules, so on. So we are going to discuss all these details today. First important thing to be noted here is the OHIP plan. I'm talking specific to Ontario. So this Ontario health insurance policy is a universal health insurance plan that government actually pay this through the taxes that we pay them. So this OHIP is actually covering most of the medical facilities like drugs, blood test and everything, but you will also need a private insurance to cover the rest of the things. So it is important to note that this policy will be eligible only for the Canadian citizens and the permanent residents, and apart from that there are rules and regulations for which it applies. Like for foreign students it's not eligible, so they will have to go through some of the other private insurance plans that the universities offer them. Similar to that, even if you have a work permit, there are some rules and regulations for which you can apply for this OHIP. So please note that first 3 months when you land here, even if you register for the OHIP, it will take at least 3 months for you to get that health card. Till then you will need a private insurance plan. So what we did is we got a travel plus health insurance plan from India for the first 3 months, so that the OHIP covers after the 3 months. So please take care of that before you land in Canada. First let's discuss about kids healthcare system here. So I'm going to tell my experience of how it worked for my kids here, because we after we came here, even my son had some bacterial infection, so I had to take him to a hospital here, and that's the first time we were taking them to a hospital, and it was really scary that how it will work and all. So it was all confusing for me in the beginning, but then when we went to some walk-in clinic nearby, so here how it works is there are so many walk-in clinics nearby in each area, so you can if for any emergency, fever, cold or something, you can just walk in. It will be all token based system, so first come first serve. So we took him to a hospital there, and so they just asked for the OHIP, that health card, and then the doctor checked and gave him some medical prescription, and the doctor fees was free, and I took that prescription to a medical store, and even the medicine was free. So for kids the prescribed medicines are all free here, and even the hospital visits are all free here. And one more main point for kids is the vaccination schedule. So because in India, when we were in India, we had to pay around 24,000 rupees for the first 3 months vaccination. Yeah, of course we took them to a private hospital. Maybe in public hospitals it is free, but we wanted to put them a painless injection because we were moving to Canada, and doctors suggested that in Canada you just have painless injections, and so we wanted to follow the same routine, so we opted for a painless injection, which was really costly. So one injection was around 8,000 rupees, so it was really costly in India. But when we came here, the same painless injection, it was really surprising for us because it was free for both the kids. Vaccination schedule differs from India and Canada, so you will have to check the vaccination schedule once you come here. If you just enter the kid's birth date, it will give you when and all to put those vaccinations for the kids. So don't miss those vaccination because it is really necessary for even a school admission. So vaccination is really important here. And basically we have to choose a family doctor here. So those family doctors will be immunizing our kids, and also they'll be scheduling some frequent visits to check how the kids are growing, how is their weight growth and all those factors. They will just check in frequent visits. Because of COVID, they are actually consulting through phones. Otherwise they'll be scheduling a hospital visit. So please do remember, for kids, this OHIP covers almost everything, so it's free for them. Let's talk about adults now. So this also I'm going to explain my experience, how it worked. So last week I went for a blood test here for some medical problem. So the doctor had prescribed me some blood test to be taken. So I went to a blood test lab. We can go to any lab with that prescription. So I went to a lab, and there were around 14 to 15 tests which I was supposed to take, and around 14 tests was covered in that healthcare OHIP plan. But there was one test which was not insured, so I had to pay from my pocket, which is $36, like 2000 rupees, just for one test. And there will be many other tests which will be more expensive too. So for these kind of things, we will have to maintain a private insurance plan. Since I am a full-time employee, my employer has a insurance plan for me. So what I did is I took that, I paid from my pocket the $36 and took the bill, and I made a claim, and they gave me 100% refund of what I paid, the $36. So this 100% payable is not applicable for all fields. So for example, I had to buy some drugs. This is also prescribed by the family doctor. So I went to the pharmacy, I showed the OHIP, it didn't cover everything, so I had to show my office insurance. Even that, the total was around $13. So all these insurance covered around $9, and I had to pay $4 from my pocket. So medical is not completely free for the adults. We have to pay from our pocket too. So please do remember, you will have to maintain a private insurance plan. And the good experience here is about the family doctor. So every time a family doctor calls, and he always inquire about our health. So it's for the whole family, for adults and kids as well. So because of COVID, they are not encouraging hospital visits. Otherwise, usually they'll schedule regular appointments, and then they'll be checking all our health in a regular basis. Even for women after delivery, they will do these cancer checkups, all these checkups they do, so which is really good here. There are some other situations like emergency medical care. So it seems that they are all free for everyone, but I'm really not sure about it, because we haven't experienced that so far. It is just by reading the OHIP plan I came to know all this. And apart from that, if you are opting for some surgeries or something like that, it will be having some sort of wait time. That is really not as in India, that you cannot go in directly for something like that. It has to be scheduled, and there will be some wait times for that based on the emergency situation. So even those things can be checked online. I will share some more details regarding this in my videos, upcoming videos. So please, if you find useful, please do like, share and subscribe.